The idea behind Medicaid expansion is that in the long run, it would reduce overall uncompensated care for hospitals. Uncompensated care is increasing exponentially each and every year because of, they claim the lack of health access and health insurance. So if an individual has Medicaid, they could go to see their primary care provider rather than having to go to the emergency room. And that sounds logical. It makes sense. But when you think about it, because there's an access problem in our state, even if you expand Medicaid, a quarter of physicians in North Carolina no longer take new Medicaid patients, really because there's so many administrative problems with the program, and it's such a hassle. They'd rather take out of pay, patients paying out of pocket, or provide charity care themselves. So even if you expand Medicaid, doesn't guarantee access to care for those individuals. And if anything, other states that have expanded Medicaid, uncompensated care costs are increasing because even though those patients may now have Medicaid, they're still going to the emergency room because it's difficult to get in to be seen by primary care providers. So you really cannot blame that patient in some cases.
The legislative debate has been interesting. You have some legislators who say, well, we need to do something, so let's just kind of jump in feet first, so to speak. Others are more cautious, saying we really need to figure out the best way to do this before we even entertain the idea of adding more people.
Yes, and I think it's good to be cautious. I think it's good to experiment with, I know Representative Avila says to experiment with what we have, look at CC&C, how can we tinker with that system and make it better, or just kind of do pilot programs from here on out, maybe managed care or accountable care, as long as there's competition that can achieve cost savings with our program and have more patient responsibility in some cases. You could have defined contributions from the government as health savings accounts initially for these patients, and they could build on their own over time, or now that the Senate has taken back, or the Republicans have taken back the Senate and Congress, a lot of things could happen in the next few years with Obamacare.